Well, thank you, Roxanne. Glad to be here. My name is Garrett Nyland. I work for Pierce County Human Services, just started, and I am here to talk to you about homelessness and kind of what's in store for homeless services in Pierce County over the next few years. And I love talking about our homeless system, how we're trying to make it better, the challenges we're having. I love finding out what folks are curious about, what folks are wondering why we don't do, and always places where we're screwing up so we can work on fixing stuff. James.
So I'm James Pogue. I'm the Executive Director of Homeless Services at Comprehensive Life Resources. I'm a mental health professional, and I work specifically in Pierce County for the last 14 plus years, trying to assist those with substance use and mental health disorder to find their way into resources and services that hopefully will alleviate some of their challenges. I've worked with Garrett and Roxanne, I'd say, for the last 4 or 5 years as members of the Pierce County Coalition to End Homelessness, and on the Continuum of Care, which oversees a lot of the county's funding that comes from the federal dollars from HUD. So I'm going to talk a little bit more about what resources look like on the outreach side when it's my turn.
Cool. Thanks, James. And I put a presentation together, but I'm super excited about going down some rabbit holes or talking about what you guys are interested in. So you can jump in anytime. You can put something in chat and we'll kind of keep an eye on that. You can raise your hand. You can just start talking because there just aren't that many of us. And again, it's really fun to kind of tailor things to what you guys are interested in. And so we left a lot of time really just to have kind of a conversation. So I am going to, boop, boop, boop. There we go. And oh, that's us. So we did that slide. So I'm going to talk today about a comprehensive plan to end homelessness that the county has a group of community members and county staff working on. I'm going to talk about something called the shelter plan, which is kind of part of that, but kind of not part of that, which is a goal to have shelter in place for everybody by November 1st, which is 19 days away. So probably not going to happen, but sometimes big goals are important. And we're going to talk a little bit about the folks that need these services and try to kind of provide a little bit of an anchor in how big the problem is. Ding. There we go. But before we do any of that, talk a little bit about what we do now. So as we talk about changing how we do homeless services, trying to do it better, trying to do more, it's really important to know that we do a lot now. And it just isn't very visible sometimes. So every year, this is like my least favorite graph here. So we'll just pretend it says something slightly different than what it says. This orange line is basically percent increases. Like I need to redo the chart to one I actually like, but this is percent increases basically in the number of people we house every year in the homeless system. So basically every year, we're housing more people than we did the year before, right? So we've got a pretty functional system. We kind of obsess about best practices. So we look at the most efficient ways to use money. We look at things that are most appropriate for people, that are most successful for them, and ethical and all of those kind of things. And we implement things that look like they're going to work well or have really shown that they work well. And because of that, again, we serve more people and they end homelessness, and many of them never become homeless again, right? The vast majority of people that become homeless end up getting housed and do not become homeless again. Like nationwide, that's what our data says. And locally, we see that as well. However, you might point out, well, Garrett, there seems like an awful lot more homelessness this year than there was last year. And you would be right. And that's because homelessness increases faster every year. Like we serve more every year, but the people that need help increases every year by a bigger amount. So basically every year we have more people coming into the homeless system, more people on the streets, and, a real strain on our resources. So I'm just going to look over this to see if there's any useful stuff. See, I don't really read the slides very well. Yeah, that's good. So we want to put a comprehensive plan together. And this is so there's plans that exist and they're not bad plans, but we've never put a plan together in Pierce County that basically says, how much do we need to do and what would we need and how would we do that, right? So say, okay, well, I know that about 12,000 people, are experiencing homelessness at some point during a given year. How many interventions, how many case managers do we need to have? How many permanent supportive housing beds? How many dollars do I need to help people get back into an apartment or to subsidize an apartment for a period of time while they get themselves steady and able to afford the rent themselves, right? How much money, how many shelter beds do we need to have in the community? Like, we've never really done any work to identify all of those things. And we're not really even just looking at the homeless system, but even a little beyond it, right? Like, we often struggle if somebody has some mental health issues or substance use issues and they would like to get treatment. Oftentimes we can't get them into treatment because there aren't beds. So we're looking, again, sort of more comprehensive, like, right, substance use is it's a minority of people experiencing homelessness or substance use, right? Have substance misuse disorder, right? And it's not, it's not half, it's probably not even 30%. And but when they do, we often don't have resources for them. So basically looking at how could we build a system large enough that that's able to meet the need, and then let's figure out how to fund it. So work like James did on the Continuum of Care 5-year plan was really all about how can we make our system work better, what improvements can we make, and what growth can we anticipate doing in the next 5 years, right? And so that was a good thing to work on, but it didn't really get us to how much money do we need coming in so that we can ask for it, right? That's my dream, right? If I bump into Derek Kilmer in a cafe, I can ask him, hey, Derek, how's that extra $22 million a year that we need from the federal government to end homelessness coming, right? And I would, in my dream world, right, I would be asking him that, and you would be asking him that, and Derek Young would be asking him that. Like, we would all be, right, asking the same thing, right? Or, yeah. So that's it. And the other thing we're doing is we're really trying to bake equity into a lot of our work and looking at that. And we're using, we'll talk about it in a bit, something called targeted universalism. That's where we set a universal goal, right? And in homelessness case, it's permanent housing, right? Our universal goal is everybody in permanent housing. And the targeted part comes in that different groups have a different set of needs. And so people that don't have a lot of wealth in their family structure, right, have kind of a different pathway out of homelessness than folks that do have a lot of wealth in their family structure. Or veterans oftentimes kind of present with a different set of needs. And so we serve veterans a little bit differently. Typically it's veterans serving veterans, right? And looking at a lot of our populations that may not even want to engage with our homeless system because we're not seen as safe. Right, a really good example of that would be Hispanic Latinx community, right? If you feel like you're engaging with a government organization that might be more of a harassment or a jeopardy to you because that's your past experience with government organizations or your family's experience, right? You might not engage, right? So targeted universalism might be or this equity idea would be, well, why don't we have some providers, right, that are Hispanic-led organizations doing that work? So that's our sense of having equity built in and monitoring it, right? Are we serving, LGBTQ community as well as we're serving people that are heterosexual, right? So we ask a lot of invasive questions, but the goal is always, can we serve them? Or let's make sure we're serving them as well, right? Because again, the goal is the same for everybody, but the pathways to get there can be different for different groups, right? How are we doing? It's hard without seeing you guys on video here. I'll just accept Ramos. No, Angela. Anyway, one video. So before we can build a system large enough, we need to figure out how big that system needs to be. So we try to count people. So how many people here have taken part in a point in time count? Right? Every January, we do a point in time count. Roxanne has. That's where we go out on the streets. And we, there's my point in time slide, right? We go out on the streets. One day this year, it's the evening of January 27th, my birthday, and the day of January 28th, right? I know how I'm going to spend my birthday evening. And we try to count everybody experiencing homelessness in Pierce County. And every year we count every single one, right? Because we're that good. Okay, well, that was a lie. So just like going into Point Defiance Park, like the chances of me counting every single deer is pretty slim, right? Some deer, I just don't even know where they're living in the park, right? There's no way I could probably have enough people to cover all 700 acres or whatever. And some deer don't want to be found, right? Deer are designed to hide, right? And if they don't want to be seen, chances are I'm not clever enough to find them. And that's the same case with people experiencing homelessness, right? People experiencing homelessness oftentimes don't mind being seen, right? We have very visible homelessness in some parts of downtown Tacoma, right? And on the Key Peninsula, in areas like Ording, like you'll notice them sometimes, but there's an awful lot we don't see, and that's because people are hiding for really good reasons, right? The amount of violence that happens, the amount of risk that you're in when you're living homeless is pretty high. And so if you'd like to not get sexually assaulted, if you'd like to not get robbed, you typically hide. And so on our point in time count day, we miss a lot of people because they're in cars that don't want to be found. They're worried that if we find them, we're the government and we're going to let DAS, anyway, Child Protective Services, and they might lose their children, right? Even though maybe their children are staying with their aunt, right? They have these narratives about what could happen. So it's not perfect. As a matter of fact, it's not great, but it's something we're required to do by the Washington state government and Housing and Urban Development. So we do it every year. But you should never believe the numbers. Luckily, we have a better source of information. In our county, we use a computer system called the Homeless Management Information System. And this is a mandate for anybody that's being funded by the state or the federal government or the county or city of Tacoma or city of Lakewood, is you have to record your interactions with people experiencing homelessness in this system. And the benefit of that is that you end up getting this massive database of all the people we're serving. And so we can basically look in the system and see how many people are currently experiencing homelessness because they've engaged the system and we don't know that they've exited to a housed solution, right? So when James's team meets somebody on the streets, they record that they are working with this client, right? And if they have a positive outcome, because James' team's amazing and pulls off miracles sometimes, and helps somebody that's pretty vulnerable get housed again, they record it in the system so we'd know they're not homeless anymore. So we use that system to get numbers. We do go back into the point in time count and we use it for some things to learn a little bit more about people. So we ask a lot of questions in the point in time count. And we ask them in the HMIS system too, the homeless management system, but we often use that data kind of to learn a little more about our population, just not how big it is. And with that, we count about 3,300 people in Pierce County that are homeless right now. And you could totally be like, Garrett, wouldn't it be a bigger number than that? And I could totally be talked into doing data analytics differently to create bigger numbers, and I can create smaller numbers. And a lot of it is that we just can't track what happens to people. And so there's always a big question. Well, we haven't encountered them in the past 3 months. There's no activity. Did they find housing? Did they leave Pierce County? Are they still homeless somewhere and just not engaging the system? So there's a lot of inability to know how many people there are, which makes it really tough to design systems when you don't know how many people there are. So I've published numbers as high as 6,000 experiencing homelessness, and it's totally possible, right? Like I would easily be convinced of that, just like I could probably be convinced it could be a lower number than 3,300. And the reason we don't know very well is because we don't have enough shelter beds for most of our community. So communities that have really high number of shelter beds, like a right to shelter place like New York City, Like they know really close what their homeless population is because they can count how many people are in their shelter beds. And that's about 90% of their homeless population. But in Pierce County, our shelter beds account for less than a third of our homeless population. And we do have about 1,000 shelter beds. And so that leaves us needing about 2,300. Oops. I'm almost to James's part, so you don't have to listen to me anymore. Then we can listen to James. But we have about 2,300 that we need. And our goal was to create that many by November 1st. And really, the thing that limits us are three things. Like to build shelter, you need three things. You need land to put it on, you need money to operate it, and you need a provider willing to do the work. And I think we have providers that are willing to grow their organizations. We have ARPA money that's going to become available, but not right now. And sites are always a challenge where to place it, because there's a real sense that there'll be more danger to having a shelter in your community than there is in having people living on the streets homeless, or as a lot of our communities see, right? There's an awful lot less danger in shoving all of your homeless people into downtown Tacoma, right? And keeping them out of Gig Harbor, or the communities that people become homeless in but leave because it's not a safe place to be, or it's very difficult to live homeless there because of harassment from your neighbors. That's a bit of a yeah. So we really wanted to create a lot of shelter beds, but we sort of failed in getting enough money coming into the system this summer. And so instead of the like 20 million that I was hoping would get pushed into shelter in the first round of ARPA money from the city of Tacoma and Pierce County, we got about 2 million. And so we're putting that into some shelter beds, which are going live. We'll have about 365 more shelter beds by the time the year ends. However, we've got a big chunk of money coming out that we're hoping to put substantially more beds. And we'll kind of see where we get on that. And I think we'll learn a lot about the size of our homeless population as we do that. Well, where to put shelters? So most of our shelters sit in downtown Tacoma. This is not a great map. I keep meaning to make a new one, but most of these dots are homeless encampments. And you can see they're pretty well spread all around, right? We don't know a lot about them on the Key, right? I'm sure there's more than just those two, or just one in Gig Harbor, right? These are where we record that we found people, right? And there's a variety of the way these get entered in. Like, I don't even think this has James's team stuff in it. This is an awful lot of data from the county's public works department, right? They kind of record when they encounter them, and when they do that, they put them in a database, and then often don't share it. But anyway, I think this one's nice just because it gives a geographic distribution of where we're stumbling across encampments. And you can see they're focused in Tacoma, but really most of our resources are all in Tacoma. And so one of the things we're really looking to do in this program is to move resources out of Tacoma, not move them, but add resources to these other communities, right? We need a homeless shelter in Lakewood and Ording, and we need one in Parkland, and we need one in, Key Peninsula, right? Graham, right? Those are all places where people experience homelessness, and they leave their support structures. They find it difficult to get their kids to school. They find it difficult themselves to get to work. And so moving or citing some more resources closer to them, I think will have a real impact, right? There's some data that shows it can reduce the amount of time you spend homeless, right? So that reduces your trauma. And going out to encampments it's difficult to know all of this because it's hard to go out to encampments, right? You can just imagine like how much time you'd spend sending someone to go visit Roy, right? If you have a case manager and they need to spend their time working with people, right? If you send them to Roy, right, they're going to spend all day traveling, and that person might not even be there when they get there. So it sort of makes sense that in order to serve more people, we tuck in a little bit in the denser areas. But I will hand off to James to talk a little bit about outreach and engagement and how that process works. And I think that touches in on, so that, this is kind of this plan, how we're doing stuff. And this is a little more how a program actually operates. And hopefully this can be useful information as you think about your work in your safe streets, and how James's resources can do some good if you know how to kind of engage them. James?
Yeah, before we jump into my presentation, Garrett, can we go to full view and look at everybody and just kind of see if there's any questions around that information. If we were all in real life, which I haven't done a lot of the community presentations over Zoom, but I've done plenty of these Safe Street presentations, and oftentimes just having a stops point where people can breathe for a second and get their thoughts together. Garrett just gave a bunch of information, and I don't know how many of you live and breathe this homeless system as a life, your work or whatever. So just I'm gonna have some awkward silence for like 10 seconds and let people get brave enough to either unmute themselves or write in the chat, maybe some clarifying questions before we transition to outreach services. Roxanne, are you raising your hand or saying please move along?
I'm raising my hand. So how do you explain to community members, and this is work that we do, but I would like you, if possible, to explain, when working with community members, when talking about putting in a shelter, and the community members say, we don't want that here because it's going to bring in crime, it's going to bring in lesser people.
Yeah, that's a good question. I actually have some version of that conversation all the time, and I had an opportunity to engage the Northeast Tacoma folks last February when the City of Tacoma decided to use the Norpoint Center as a warming center, and that was the general gist of it. And I can let Garrett definitely answer some of this, but a lot of the questions, like people are thinking of like the nativity house a lot of times when they think of shelters, which is like 120, 180 sometimes clients really congregate packed in with the idea what we call low barrier, which is trying to create space where people can come as they are, which includes they might be under the influence, mental health issues, things like that. So those are they see that, they hear that, and they think that's that experience, or all those tents along I-5, like that's what's going to move into my neighborhood. When in reality, like that's generally not what shelters we're looking at. We're looking at community members supporting smaller shelters. There's some good opportunities to look at, like on 6th and Orchard, a tiny home village. It's on a faith-based community, how it's set up and how it's clean and how it's supported. Most of the folks that we're talking about as homeless, it's really bad to categorize people by their economic or housing status because they're so different for so many reasons. And I have a slide in one of my, that may be in the presentation, so I can't remember, that shows like all the bubbles that oftentimes have to influence somebody's situation to end up homeless. It's not typically one thing, and it's not a good categorization. So it's, again, we're looking for the people who have the most desperate need and how to support them. And the question I always ask is like, kind of what community do we want to be? Do we want to be the place that helps the most destitute among the community without resources? And there's just not evidence. Like I had a people saying that my property values will go down. Well, I can pull up Zillow and just show you all the shelters in Tacoma and show you the property values haven't gone down for decades anywhere. So that is easily, thwarted. But there's also a little bit misconception because, again, a place like Nativity House that has so many people living there, yeah, they do have to call resources, oftentimes police, fire, whatever, to help support them because of situations. And I would just say, like, moving a hospital into your neighborhood, they're going to have more gunshot wound victims at the hospital because that's where you go when you have a gunshot wound. It's not because of the hospital that those folks are coming into that area. It's because that's where they need to go. And similarly, shelter doesn't create more crime. It just is where people need to go. And then there's like residual disturbances that people blame everything on the community shelter. I don't know if either one of those helps. Most people just don't want to have that conversation about in my neighborhood. So part of it is helping them go see shelters. And if you go to the Nativity House, you're going to see the emergency room in downtown Detroit or whatever, versus just going to some of these other smaller options that have the family shelters or the tiny homes or the stability site, which also is 100 folks, but it's set up in a way that it's not so congregate. I don't know, Garrett, do you have other thoughts about how you address that question?
No, that's pretty good. I think, again, people come from all of our communities. So I try to emphasize that, like, we'll look at how many people are homeless now in Pierce County that used to live in the Norpoint neighborhood, right? Mm-hmm. It's not okay for us to have those people living on the streets in our poorest communities, right? Like that's not okay for our poor communities, which oftentimes are communities of color. So just that, I mean, data wise, like there's no more violent crime that happens around a homeless shelter than anywhere else in the city, you know. And so there, I mean, there's some interesting data around, again, home values. There's really good data that shows that, most communities are a zero impact in terms of property value because of a shelter near you, right?
Angela / Ramos.
Yes, I have a question in reference to the homeless, of course, what we're talking about. We are constantly trying to appease homelessness. We always, don't get me wrong, I'm for that. However, there are people within that particular community that don't want to be housed, okay? And we still invest money constantly trying to convince them what we think is good for them. So my question is this: why can't we use the money, talk to them one time? We got a house for you. If you move in, blah, 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 this is what can happen. This is what we can do for you. And if they say, well, no, why don't we move on instead of just staying there and talking to them for 3 days and trying to convince them to do something they don't want to do?
That's a good question. And I can, again, I have, just like Garrett, like I can show data that the first conversation, it's about 9 or 10% of the folks that the first time I meet them, they're excited to see me. They're desperate for resources. They probably get talked to all day long by lots of people anyway. And they're super like, whatever you have to offer, I'll take it. And that's just not the norm. Partly, it's not the norm for us either. I don't know how many of you would be excited if someone knocked on your door, and like most people don't even answer their door anymore. But if someone knocked on my door trying to sell me something, there's a good chance I would avoid it at all costs. But we find that once we get to the second, third, fourth conversation, our percentage goes up significantly higher. Like we're building trust. We're having conversations that people are building upon. If I had 100 empty rooms right now and I walked the streets and offered them, they would be full by the end of the night. And I've done this before. I've gotten the city of Tacoma to give hotel vouchers to us, and we had what was supposed to be 25 of them, and they said just go find the first 25 people that want the hotel. Well, after we put 50 people in the hotel, I went back to the city and said, so that 50 beds that you gave us, they said, oh, you mean 25? I was like, okay, well, either way, I think it's got to be closer to 50 to 100 because we've already filled it and we're going much beyond that. So part of it is like people don't have actual resources to end the situation. Like I don't have beds to hand people, the bedrooms or house. Like that story that you said, I should just offer them housing and move on. If I did have that housing, I'm guessing most people would take it. Like I haven't met anybody for the most part who doesn't want something better than living in the streets and being subject to the weather, to the traffic, to the lack of sleep, to the lack of food, lack of hygiene. Like most people, if again, I can show information that when I had hotel rooms, people took them. Like they were like hotcakes. People would take it. But a lot of folks have been offered stuff for years and it just hasn't worked out. So there's a lot of mistrust. And oftentimes it was from somebody who looked just like me. I showed up, I have a coat and I have a badge and I have a business card and it said, I have resources for you. And it just didn't work out for them. And so part of it is our response is to blame the person, when in reality, we don't know if that person would have been successful because we don't have the resources to show that. Even in the data that Garrett showed, we're currently under like shelter beds by at least 2/3 of the population. So there's a narrative out there too that people don't want shelter. They're offered and refused it all the time. Typically, our shelter beds are 95% of the way full, and most of the people you find camping would take some version of shelter. So they might not like sleeping in a room with 100 other men, for example. They might have anxiety or PTSD, or they might cough, or they might do other things that cause it very difficult to sleep in that environment. And their option is to choose to sleep outside rather than take that resource. But it's the lesser of two evils. It's not that they were offered like a legitimate housing option. And I would just say, like, until we get to the point where we have enough to offer, we don't know what people will and won't take. Because right now we're not offering that. If I work with somebody on outreach, and I can get onto my slides in a few minutes, I'm typically working with them to navigate a very complex system on a hope and a prayer that they will be one of the ones selected to get this resource. It's never a guarantee, and our outcomes, again, are closer to 10% of the folks that we serve are able to find housing, and it's not because of any fault of their own. It's because the system is not adequately built to address their needs.
So in a given month, about 850 people start a new episode of homelessness in Pierce County. And in a given month, probably 10 or 15 permanent supportive housing apartments, like the only apartment that we actually can offer someone, become available. Right. So that's a pretty massive disproportionality. And most people don't need that level. But if we're talking about incredibly vulnerable people that don't have a lot of chance, like schizophrenia, they've significant physical disability and very little chance of increasing their income beyond their disability payments, like those people need an awful lot more than we, again, that the massive the lack of resources, really mean that what you're describing isn't something that we can do for the vast majority of our people, which is why we need a system built, sized, so that we do have, the right intervention for people when they need it.
Roxanne, were you trying to raise your hand again? Yeah.
Yeah, because I wanted to say, when you talk about lack of resources and when you talk about the different reasons why people turn down that assistance that's offered, there's also when someone's offered something, even if it's a shelter bed, but you can't bring your dog that you've had with you the whole time, or you have to stop drinking right now. You have to stop doing all these things. So there's barriers placed on you to be able to sleep in a bed for a night. And these things aren't explained, even with when I don't want to say law enforcement, but when someone says to a community member, well, we offered them services. Well, if you offered someone a chance to go into drug rehabilitation, substance abuse rehabilitation, are you offering them that service right now? Or are you telling them come back in 3 days? If they're ready to go right now and you cannot give them that service right now, you've lost them. But is that explained to people when you say, well, they turned it down? 9 times out of 10, it is not. And this is your presentation, but I had to say that.
No, and I appreciate that. I'll just give a recent example. Like I actually had an opportunity to talk to Connor before this meeting. I had met him virtually, but not personally, because we had a partnership with a presentation with some of my employees at the Marlene's Market in downtown Tacoma off 38, I think. And when my team was there was a conversation about one specific person that was in a wheelchair or was frequenting the businesses in that neighborhood. And like, there's just like story after story at this meeting where there's like, oh man, this person is like, we've offered him everything. He doesn't want it. He's so disruptive. He's always outside my business. And so of course my team went out and met him and spent a while talking to him and like trying to build his trust. And the same day we learned a couple of different things about him, including that he had a severe infection on his foot that made it very difficult for him to walk and move, and that he qualified for some other resources that we had. And we were able to like get him to a nurse and a doctor and spent all day with him at the hospital. And we had an opportunity to take him to a hotel room we were able to secure through one of our other programs. So this person, like, to the business owner, it was like, this person just won't leave or go do his thing. But spending some time with him, besides the paranoia and other things that were going on with him, he also had a severe medical issue that made it difficult for him to leave that parking lot area, which he had kind of chosen as his home, for lack of a better term, because he had access to some food, to some shelter coverage, and that was his place of choice. But it took a while. Luckily, my team in one day were able to get to the point where he was willing to share that he had these medical issues, and we were able to find him access to some resources. And hopefully he's still working with the team and going on his way to something better. But sometimes the answer, like Roxanne said, has to be like immediate relief before somebody is ready to understand that there's like hope. Because one of the biggest things that we're trying to overcome working with folks that are experiencing homelessness is they call it learned helplessness, which sounds like something that the person did themselves, but the system has failed so much and the resources that are supposed to be available didn't work, that the folks on the street have learned that they're not going to get out of that situation without some level of hope and a prayer. A lot of people do, but to the common looking, the numbers keep saying the same or raising, so it feels like nothing's ever changing, when in reality, a lot of folks are finding lots of little successes, but it's just sometimes so monumental. So I'll leave a couple more seconds for questions there, and I can jump into my presentation. I didn't know, Garrett, the slide that you started was like the third or fourth slide on the presentation I sent you. I'm not sure if that's where we're going to start, or if we're going to start there, that's fine.
If you want to start back at the beginning, I was just picking my favorite starting point in the middle. But if you want proper, I can get you going on that. Let me.
Either way, I can go. We have about 40-ish minutes, right? We're going to 8. Is that right?
Yeah, 40 minutes.
I think my normal presentation is like 20 minutes. But for again, in real life, my style would be interrupt me at the moment during the slide and let's talk about it. And if I don't get to the end of the presentation before my 20 minutes, that's fine. I would rather have the conversations that's most relevant. So I'll invite folks here. Same thing, chat or unmute yourself and just share. And I'll do my best to go as quick as possible. If you want to skip this slide, Garrett. I don't really need to go too much in the brief history of COMP, but we've been in the downtown Tacoma for the last 50 plus years. We've been doing homeless outreach since '96. We had a very small group of outreachers looking for folks specifically with mental health or substance use disorder from '96 to 2014. So almost 20 years of really just trying to find people who aren't connected to our agency, who need our agency, which really is behavioral health support. It wasn't until the city passed the 1/10 of 1% sales tax in, I think it was July of 2013, is actually when they started collecting dollars. And a year later, 2014, we expanded our outreach efforts with those dollars. Then we've just exploded. And then we have a bunch of programs really focused, if you want to slide to the next slide, on trying to connect anybody with whatever they need. So there's kind of a narrative out there that we're all sort of one paycheck away from homelessness. There's like national studies that show that if anybody had an emergency, like half the country had an emergency of $400 or more, that they wouldn't be able to cover it. I like to dispel that myth a little bit, that everybody's one paycheck away from homelessness, because most people on this call and probably in the community have some safety net of family, friends, neighbors, churches, somebody that you would call if you lost your job, or you would get unemployment, or you would do a variety of things before you actually ended up on the streets or in a shelter. I think the number of people who lost their job, this is pre-pandemic numbers, but like the unemployment rate at some point, oscillates between 3% and 8% or whatever. But the actual people that enter the homeless system is like 1% of the United States, or some numbers have it as much as 3%. So oftentimes the people we're serving is not just financial reasons or lack of financial resources that causes them to end up on the streets. It is usually 3 or 4 of these things. They're evading an unsafe situation. They have medical issues. They have mental health issues, and they don't know how to handle it, so they just bolt. It can be substance use issues. And then, of course, when they are homeless, a lot of times shelter, food, hygiene are also things that need to be addressed. If you want to hit the next slide. So our outreach team does everything that we can to know all of the complex systems out there that some of our individuals might need access to. These systems don't talk to each other, not specifically. And so there's a thought that maybe if an outreach team member takes a person to shelter, that the job is done. Like they've gotten into shelter is going to have access to housing and employment, and from the shelter they're going to flourish. That's not the typical case. Not all shelters have supportive services. A lot of times a cot is what you get. So it might even be a situation where they sleep there at 7 o'clock at night and they're out at 6 in the morning. So they still have to spend the whole day navigating what to do with themselves, their belongings, A lot of folks have to get access to ID cards and employment or financial assistance through DSHS. So a lot of times we're just restarting people's benefits and taking them to get connected with their other benefits and get their medical insurance and get them connected with mental health, substance use. But those things typically are really hard to keep services on if a person is homeless. And I like to use, I use medical examples all the time, but if somebody went to the emergency room for a heart attack and the doctor's like, man, you have high blood pressure, diabetes, you're obese, we probably should address all those things first, and then we'll get to your heart attack. That's sort of what we do here, where we say, hey, you're homeless, but we should address your financial stability, your mental health, substance use issues. We should get you employment and education. And then when you prove it, we'll help you find housing. So it's a backwards way of thinking in my mind, because honestly, the emergency is that the person doesn't have food and a place to sleep. And those things need to be addressed first. And then we can go on from there. And if you want to skip slides, and again, I'm going to take a drink of water, but if anybody has any questions, feel free to interrupt as we continue. Something that we find is super important is simplicity. So we have one phone number. You can call us anytime and leave a message. We don't deploy after hours, but we have email and a phone number. Clients can call us, anybody can call us. But the other thing that's super important is that I have about 15 outreach workers over different grants that cover the whole county. And most of them, I'd say 12 of them, identify themselves as in recovery. And that could be substance use recovery is what a lot of people think of. But we also have folks identify with mental health disorders, and most of my staff have had some time being homeless or being incarcerated, one or the other. And that's super important because the folks that are receiving the services oftentimes feel like nobody understands them, that the system doesn't work for them, it's too hard. And if you have an empathetic ear that says, well, yeah, you're right, all that stuff is true. I don't understand you, but I had to do some of the same work myself, and I understand something like your situation. Let me tell you what worked for me. Like that lands a lot better than coming to them just as a professional and saying, like, I don't really know what you're going through, but what you should do is ... which doesn't land very well. And also, it's not inspiring, and it's also not always helpful, because we do need to look through the perspective of the people that we're serving. If you want to slide, Garrett. So we use a lot of techniques just to try to understand our folks and make sure we are always looking at, like, how do we reduce barriers into the services that we need to connect folks with. The number one barrier we actually have to address first is hopelessness. And so that's one thing, but the very next thing is transportation. It seems like such a small thing, but our bus system is not adequate to meet all of our folks' needs. It's not free all the time. And our folks oftentimes have all of their personal belongings in a backpack or in a tent or wherever, and leaving those belongings like unprotected to go on a bus ride for half a day to the DSHS office or to go find employment is very risky. It could be the difference between the person having access to their medical or financial information and not. So we try to transport folks. We oftentimes are driving folks all over the county to address their needs. So these are the top 6 things that we offer. I guess is connection to, but connection to mental health resources is one of the big ones. Substance use, again, like Roxanne said, the folks who need these resources typically need them now, and medical is a big one too. Is like they need to be driven to the place where they can get access to the resource on that same day. And so we have a lot of partnerships with a lot of community providers where we ask them, what does it look like for us to bring a person same day? And so we have even employment. We have same day employment partners like Vallejo Vocation, downtown Tacoma. But the number one thing that we work on, believe it or not, is actually transportation, with the goal, of course, to secure permanent affordable housing at some point. And we have some data that I'll show in a minute about how successful we are with that. So we use every single resource we got. Half of these are in the system that Garrett described. The coordinated entry is sort of where all the HUD dollars go and how people get access to permanent supportive housing or rapid rehousing, which is like a temporary housing assistance voucher, or diversion, which is a one-time financial assistance. But we also look at trying to reconnect people with family outside of the community if they're not local, or if they are local, trying to figure out why they can't, or why they feel that they can't reunify with their family. If a person is having is the danger to themselves or others, which generally looks like being suicidal, then we can work to help them get stabilized at a crisis center. If they have medical or ongoing care needs, we can look at like nursing home or adult family home. And a lot of times we have to really negotiate with community members. Like a lot of the system is outside of a formal system. There's faith communities that have like transitional houses. Sometimes that's a good option, or clean and sober houses. Sometimes we just have to find a landlord that's willing to take a risk on somebody with like a lack of employment or criminal record issues, where maybe comp is going to cover a couple of months rent and help the person kind of get restabilized and get connected to employment, if that makes sense. But I mean, honestly, the system is not linear, and it is a lot of beg, borrow, barter, trade, and trying to figure out what's available out there that's going to meet this person's needs. And everybody knows that the cost of housing has just gone up so significantly that a lot of times these resources, the vouchers or day labor, it's just never going to meet the need. Like you can never catch up to have twice the rent plus deposit, first and last month's rent, and qualify for an apartment. And I used to run a young adult shelter downtown Tacoma. And speaking of people who had thoughts about what it looks like to be next to a shelter, right across the street, a high-rise went up during that time and was always full. And they rented their 2-bedroom apartments for $2,400 a month right next to alma mater. And then a block up the street from there is another high-rise going in right by Tacoma Public Library. And that's a couple of blocks from 2 or 3 shelters. So somebody feels like they can build housing right next to a shelter and they're not going to be impacted. And I'll tell you from experience, those apartments are full, or have been full, the ones that I'm referring to. Next slide. So one of the big things that we try to do is meet people where they're at, both physically, but also like mentality wise. Not everybody's ready to open up to a stranger or a person they just met and share that, like, all the things that have gone on in their life. So if they just want to talk about needing access to a shower, then we're just going to talk about getting access to a shower. If they tell me to go F off, then I'm just going to go give them my business card and say, call me later when you need me, and I'll try again next time. It just takes time to build those relationships. And then you can see we kind of share a lot of resources with our partners in the community and try to help them find whatever is appropriate to address their needs. Typically, like I said, isn't just like a lack of financial support. It's oftentimes it's many facets. And so this is the data. I believe I took the data from this year up until the month of October, so 10 months. We served 595 clients, just some demographics, a few more, like a little bit more male than female. A group of 25 to 54 was the largest group that we served. And then the racial breakdown, white was the most that we served, more than half. And then African-American was second. And of those, keeping that number in mind, so 600 clients, if you want to go to the next slide, of those 595 clients, you can see 43 of them got access to mental health, which means we physically took them to a clinic, they got assessed and they stayed engaged. Same with substance use. 25 of our 600 found housing. And then you'll see that we got 57 into shelter, and then employment and medical services were the last two. This, of course, might be the same. One person might be in multiple categories, but if you assume that some of them aren't, I mean, somewhere around 100 or more people were willing to accept something from us. But of those people that we worked with, we were only able to find housing for 25. And so, that's just a good number. Like, we met 600, and then you can realize, I don't know if that, I can't do the math off the top of my head, but it's like 5%, give or take, that we're able to find housing for. And I think, yeah, you can show you kind of skip the slide about where we are located, but same as the slide before that Garrett showed, the bigger the bubble, the more places we go. We are in downtown Tacoma, and we get a lot of calls from Tacoma. We do outreach, but we're really complaint driven. So a lot of fire departments, the sheriff department, like all the fire departments, multiple libraries, anywhere that people generally congregate, homeless folks congregate, or people get served, we try to be connected with those. So we get calls from the sheriff, we'll drive out to South Hill and we'll meet clients out there. Or you can see some of the folks up on the peninsula, even a couple that have gone us into King County, which we aren't funded to leave the county, but if we get a call from somebody and the way we did the work ended up us getting into King County, we'll go there. So yeah, this is really where we're seeing folks at. And a lot of that's based on whoever in the community called us and we responded to these locations. So again, I want to give a story. It's a kind of a medium length story, I guess, but just to kind of show, this is back to the question of like, why do we take so many attempts to help somebody? So we got a call from a father in Maryland who was looking for his son. And the reason why the father knew his son was in Tacoma is because St. Joe's Hospital had called the father and said, hey, we got your son here. And then the son left, didn't connect with the father. The father's like, this is what the person at St. Joe's told me, that my son, who's in his 30s, 37-year-old, is living homeless in Tacoma. And he described this location that we think he might be at, and that he has an abscess from a MRSA infection from use of opioids. And he left without the treatment, and we're really nervous that he might lose his arm or worse. And so that's like all the information we got. We got a very vague, like, this is the kind of area he sort of hangs out into, and we were able to get some street names, but the dad didn't really know Tacoma. And so he's like, this is what I got. And so we did a little bit of sleuthing around. We tried to reach out to St. Joe's, but of course, St. Joe's couldn't share any information with us, which is great. They shouldn't. They didn't know who we were. And they partner with us, but they didn't call us about this client, so they shouldn't share. And two of my staff members went out looking, and strangely and randomly enough, we found him. We found the location that the father gave us. We found that he was there. We introduced ourselves and said, we got a call from your dad. That conversation, because of the introduction from the dad, helped, but the son was still weary about going home. His dad said, I want him back. I'm interested to help him out. And he said, I'm a disappointment, and all the shame that was going on. And so we started to talk with him. He had also a partner that he was staying with in his tent, and he wasn't quite ready to leave her. But after a couple of conversations that happened over a couple of different days, we were able to convince him to go get the abscess taken care of medically, and to look at going back to relocate. He wasn't ready to relocate because of his addiction, so he wanted to go into inpatient treatment. And so we used some of our partnerships to get crisis beds, where he went, he got an assessment, and just like Roxanne was saying, the assessment for inpatient took him so that it was going to be 3 more weeks until he was going to get an inpatient bed, and the bed was going to be in Cedar Woolley. And so we're in Tacoma. We're trying to get him the 90-day intake. He's waiting in this crisis bed. The day comes for his inpatient bed. Everyone's excited for him. He goes to get on the bus to go, which is like a transport van. And they say, oh, I'm sorry, we don't have your medical screening form, the one that we need from your MRSA infection. You're not going to be able to go until you're medically cleared. And so we're not going to let you go today. And that instantly led to his belief about that this was never going to work out. Nothing ever works for me. I'm going to fail. I'm just going to give up. So he left and just like disappeared. Well, the team went back to go find him. We're able to find him where he was, took him to St. Joe's to get medically cleared, but also someone at St. Joe's said, hey, if you're going to go back to your dad and you've been dealing with opioids, you should try medically assisted treatment. It might be a better option than waiting for another inpatient bed. And so we hooked him up with a place that got him Suboxone. He was able to get Suboxone the same day. We took him back to the crisis bed. We set him up. We got him a transport set up through an airplane ride. We also got Suboxone set up when he arrived in Maryland. We took him to get his Department of driver's license, because they wouldn't let him on the flight without it. Like, we had to do all those other pieces, and it took, like, I would say from the first time we met him to the day that he got on the plane, it probably took like 6 months. Well, he got on the plane, got there. Dad called us that he arrived. Everything went well, and about 6 months later, they called us on Skype or Zoom or whatever pre-pandemic to just thank us. The son was doing well. He was healthy. He had been sober the whole time on Suboxone. He had put on a bunch of weight, was starting to work again. Everyone, I mean, this is a huge success story, and it took a lot of chipping away and a lot of not giving up and a lot of really creative work by my case managers who spent a lot of time with this family or this person. That's part of the reason why it takes more than one meeting, because chipping away at this person's situation and really learning what's going on and what motivates them and where they're going to end up, it takes time. It takes time to figure that out. I don't think I have any more slides. If I do, Garrett, you can slide through, or I think there's some, homelessness is lack of affordable housing. I think the other thing to note is when you see folks on the street, on like living in tents, you're typically seeing the most vulnerable, the most disabled, the most mentally ill. There's a whole population, like Garrett said, that's like hiding. The ones that are sort of laying out in the open are a little bit more have so much complex issues that they've sort of given up on the idea of hiding to some degree. I see that we have a question, and I'll let April ask a question. And there's my contact info.
I was just going to ask what you consider affordable housing, because we have a condo development that's coming up that's being built near me, and they claim that it's affordable housing, but each one is $300,000 to $400,000.
Yeah, so I don't have a good definition for affordable. For me, it's all about what are my clients' resources and what can I find. I'm sure Garrett will give us some HUD definition or a number that's like a little bit more of the real. But most of the housing vouchers have a formula that says affordable, and they give you a percentage of what fair market rent is and things. And our experience is they don't cover enough to meet the Tacoma market. But I'll let Garrett take it away, and we can actually close the slides unless people want my info. We can send this out later, but that way at least we can look at each other. Garrett, what's affordable housing?
Well, affordable housing typically has to do with rentals, is what we most often discuss. And that's when you hear people talking about affordable housing, typically it means under 80% of the area median income. And that's a substantial amount of money. And it's not what people experiencing homeless typically make. So most of the people we work with are well below 30% of the area median income. And so when we hear people talking about affordable housing, it's not a bad thing, but it's not something that serves most of our really vulnerable. So you might have somebody that's has had a disability early in life and is making only $775 a month from SSI, so Social Security program. And, what could they afford, right? There was a day, right, when they could afford a room in a boarding house, 20 years ago. They probably still can in Houston or in New Orleans, but not in Pierce County. And the cost to build something's pretty high. So if I wanted to build a 50-unit apartment building with 1-bedroom apartments, I'd probably be looking at a cost of about $300,000 per unit to build it. That would be government contracts. And so a $300,000 condo it's kind of what it costs to build these days. That's one of our challenges in building enough housing is, we need massive subsidies in the building of the housing in order to run it as something that people experiencing homelessness can afford. And we need, substantial ongoing subsidies if we want to use the general rental market, because it's so expensive. And the only way to stop it, the only way to fight that really is with building a lot more housing. So it's possible that rezoning so that we increase density will be a surefire way to, in a decade, increase the amount of housing we have.
Thank you.
Like in the past 10 years, every year, the percent increase in population in Pierce County has exceeded the percent increase in housing units, right? So part of the reason we see a growth in homelessness, actually probably the one statistic that matters, like tell me one statistic about a community and I'll tell you whether they have normal homelessness or whether they have a homelessness crisis like we have in Portland or Seattle or San Diego or Pierce County. And that one statistic isn't the amount of domestic violence or the amount of disability or the number of veterans exiting service. It isn't the amount of substance use, right? It's really all the rental vacancy rate, like how many rental units are available, which really determines how much supply and demand impacts the cost of housing. So in Pierce County, 3% rental vacancy rate. Rent goes up faster than inflation every single year. And so people at the very bottom, they just drop out. So even though we worry about the individual people and we serve the individual people and we help the individual people, the real way we help and serve all of those people is dramatically increasing our housing. And it's lots of ways that we do it, but it has to be massive amounts of new construction. Hopefully a bunch of it targeted to our people. But even if it's not, right, people rent down. Like people have no problem renting down. The person that wants the $600,000 condo will take the $500,000 condo, and the person in the $5,000, will take the $400,000 condo, right? You add one housing unit, right? It doesn't matter if it's a low end or the high end, right? If you take one away, it doesn't matter if it's at the low end or the high end. If you took one unit away, the person that wouldn't have housing would be the poorest person, right? Like. The rest of my slides are really boring. Let's have some more questions.
Yeah, any more questions?
I have a question. This is Sue Hart. Sorry, I'm driving, but and you may have covered this, and I didn't get to hear it because I've been trying to get on. At one time, I thought that they were going to be doing some renovating of some of the older abandoned buildings in Tacoma. Have you thought about that as a way to help with homelessness, or did you already cover that?
No, we didn't cover it, and there's definitely some developments that have been started. Like I know that the Kmart on 6th is being repurposed as something, and there's the Rite Aid building on Martin Luther King up in Hilltop that's been purchased and is being rebuilt. But I think it's all part of the concerns that Garrett was talking about. We just can't build fast enough or cheap enough to keep up with the housing demand. But I'll let Garrett, this is more his department than mine.
So renovating a building is a great way, right, to add housing, right? I mean, if something's not being used, you can renovate it. We really just look at the actual cost per door. Like that's kind of how we think about it. Like what would it cost to buy it and to renovate it so that we could use it for affordable housing? Then you got to find an agency willing to do that, and you have to find a funding source to get it. Right? I mean, that's kind of how all of that kind of hammers out. And you can only do so much public-based stuff. There's only so much money available, and yeah. So we do stuff like that. It's uncommon though to do renovations. That's typically more of a private market type of thing, although it's not exclusive. But the two that James mentioned, those are tear downs, right? Tear both of those buildings down and build new housing. So the one on MLK is going to be affordable, and some very affordable, right? Less than 30% area median income. The stuff where Kmart was is going to be a bunch of somewhat dense housing, kind of townhouses that I don't think there's any intention to make much of that affordable. Or if it is affordable, it's 80% AMI.
What about the tiny houses? Can you talk about those some?
Love tiny houses. So again, the whole goal of tiny houses, well, it depends what you mean by tiny house. So if you're talking about like the Lehigh tiny house village, so that's a shed, right? It's a well-built, insulated, electrical, no plumbing shed we can build for about $5,000 or $6,000 worth of materials, and provide a very safe place for someone to live. 8 foot by 10 foot storage for your things, privacy, right? Still congregate in that you're sharing typically food preparation and eating space, dining space, you're sharing bathrooms and hygiene spaces. And so those are really good models for short term, and probably even in our community, somewhat long term, just because it's going to be so challenging to build enough housing. There's more expensive models of that, and they get very expensive very quickly. right? You look at something like the new tiny house village in Ording. So each one of those, it's a veteran specific, I think 30 units. And each one of those came in at about $200,000 each. And they have plumbing and I think a little bit of a small food prep area, right? But again, your cost per door is in the hundreds of thousands of dollars. And 80 accessory dwelling units are one way we'd love to see density increased in a city like Tacoma, or a lot of our kind of suburban cities where you add, like we're talking in my house, let's get rid of the chicken coop, let's put a 250 square foot house in our backyard that could then be an income source as we get older, and also a place for someone to live, right? That kind of increases our density. And I can build one for $100,000, right? If I were to pay someone to build it. So a lot of those they're not cheap, but they're cheaper than our government built $300,000 one bedroom.
Just to clarify the point, I think you made that too. There's a lot of interchangeable with the word tiny house, and there's like Gary said, we're using a lot of interventions that called pallet shelters that are really what Gary described as sheds that are some of the better options for shelters. They're better long-term, they're private, people can lock their belongings in there, have a private place to sleep, but they're really geared towards addressing the shelter need, not the housing need. When like you said, that I'm a huge fan of like legitimate foundation poured tiny houses with like hooked up to Puget Sound Energy or Tacoma Public Utilities, and it has like a legitimate house as a long-term option. But again, yeah, all of these options are great. We need some version of all of them to address the shortfall and the potential growth. Like we're looking at what we need to address today's population, but based on the growth and how we're building, it's very possible that this will be double in just a couple of years of what we need, or half of what we need, I guess.
And a lot of times it's land, right? A larger tiny house village, right, where it's a foundation and all of that, and plumbing and electrical. You're looking at a larger piece of land. You still want them near bus service, right? Our population tends to really have challenges, affording vehicles, and there just aren't a lot of plots like that, right? I can build a 50-story building, right, on a nearly one lot. If I don't have parking, right? And I would need, a substantial number of acres if I were to do that, right, as a tiny house village.
We have a property over by Charlotte's Blueberry Park that was owned by Green Harbor that was building a bunch of homes there. And I think because of the pandemic and everything and the cost of wood, they have stopped that project and are looking to sell that land. Do y'all know anything of that Green Harbor project? And is that something that's feasible for helping this homeless problem? There's, smaller homes that were supposed to be a lot more affordable.
No, it's interesting. I'll have someone take a look at it on the affordable housing team.
Okay, yeah.
I mean, it's funny.
It was really sad. They built like 2 or 3 of the houses that are just sitting there now, and just dropped the whole project and are now looking to sell that big piece of property.
Okay, you're off.
Okay. I just have a quick question. There's a lot of people around here trying to buy houses for cash. These dilapidated houses in the area that nobody is living in. I don't understand why the city can't invest or get with that property owner, invest a certain amount of money in the property to bring it up, with a stipulation that they could, rent it, or we can rent it for this amount of money for a certain amount of time, which in turn will help the homeless situation and help that landowner bring the house up to code. And it also helps Tacoma by getting taxes for a house that's, up to date. We got to think outside of the box and just not constantly think about building new stuff. We need to use our existing.
Well, because, people want money. It's all about the money. So those people can sell that house instead of, giving it to the city for a lot.
But they can sell it more if I invest $100,000 in it, and it's a 3-bedroom, 2-bath. I could put 3 people in that place. You know what I'm saying? I'm just thinking outside the box. You know, and you know that way, if I had a dilapidated house, and you come and tell me, well, I'll invest $100,000 if you rent to me for 3 years. No problem. You win, the city wins, everybody wins.
Yeah, I think some of those options need to be on the table. I know that the city and county and different areas around Pierce County have looked at their own properties of what they already own. Some of those places are investment owned or bank owned, and trying to get some larger non-local kind of corporation to pitch in hasn't been successful for some perspectives. But yeah, there's definitely I think all options are on the table. I represent a nonprofit, so I don't represent any of the government entities that would need to be interested to do that. But I definitely know those conversations are being had and continue to be had. Those versus like everything, like I said, every Kmart building that's ever been vacated throughout the county has been thrown into somebody's idea as well. But I mean, all ideas have to be on the table, because again, we're such at a crisis point now that we're not going to get there until we really overhaul the way that we look at our housing in Pierce County.
And the money for affordable housing is massive, right? You just end up spending a lot of money really fast. So, but I think any way you can increase what you're buying, right? I mean, again, that's like, we're interested in buying hotels. Why? Well, I can buy a hotel for about $100,000 per room, right? For me to build a unit like that, I'd be putting in about $280,000, $300,000 per room. You know what I mean? So if we can buy those at that discount, I can buy 3, I can triple the number of rooms, right, for that lesser amount of money. So anytime you can put a proposal together that somebody can fund, right? I mean, that's how government has operated in the past, not as a deal creator, as much as an organization that's capable of responding to opportunity. And I think we need to change government a little bit. I think we need to be more putting deals together with other people, with, like, oh, somebody has some land they'd love to see developed. Oh, this nonprofit would like to do some, operating of a affordable housing or permanent supportive housing, but they don't have the capacity to develop. Oh, well, one of the housing authorities wants to develop, but they don't have the ability to operate it. Well, let's put those 3 together, right? Let's be a matchmaker and see if we can't, as a government, right, or a community group, kind of put some of these things together to make them work. And we do that a lot with kind of even what you're talking about a little bit, where we try to support folks that are like, look, I just want to buy like 3 houses, and I want to find a way to run them as sort of transitional housing with people coming out of treatment services where they're clean and sober. Like, that's what I did when I came out of treatment. It worked amazing for me. Having trouble finding it for friends. How could we do that? Okay, well, it's tough, right? But these are the ways you can do it, and this is the role government can have, and the role you'll need private funders. You know what I mean? Like, try to help people navigate what they want to do that our community needs. But it's frustratingly hard, and we need to get better at helping people be successful with that. I think in my 45 days working for the government, I got dreams, folks, dreams. One thing I'm going to let you all know about, I'm going to put it in the chat. Speaking of government, we have money coming down the pike to run shelter. Don't really know how much yet, probably 20-something million. And we are asking people for ideas about how they would like to run shelter, or how they might want to be part of that. And so I'm going to toss into the chat here just a link that you can get to that proposal. Or if you know a nonprofit that's never done shelter work and is interested, if you know a church that has land that they don't want to run anything, but they'd love to see their neighbors served, right? You can put anything you want in that bid. It doesn't obligate you to anything. It doesn't really have any impact, except lets us know that an organization, right, is interested in kind of being part of a shelter solution, or really any homeless program solution, to be honest. So I threw that in there, and Again, if your church, if you know a nonprofit, like, oh, I work with Community and Schools Lakewood, we'd love to do some housing programs. Well, put in there what you want to do. We got a whole section for like, what are you going to have a hard time doing? Tell us and we might be able to help you out. Right? Again, reinventing a little bit the role of government as a matchmaker. And I'll put my contact info in. I'm always happy to come talk to anybody about homelessness. And I think James is too.